Hello guys, welcome to again another session, and today we're going to be talking and giving some tips on how to prepare and pass the Department of Health licensing in Abu Dhabi as far as the practical nursing is concerned. So this video is coming to you on popular demands. So we've gotten a report on how this section of the nursing exam is posing some difficulties because there are some certain areas which I've tried to identify that focus has to be taken care of. So, first of all, we know that most nurses who go in for this practical exam in Abu Dhabi are registered nurses back in their home countries, okay? They've done the 3 years diploma course. They are qualified registered nurses. Unfortunately, only in the UAE they are bound to take the license exam as practical nurses or assistant nurse. It's the same thing. So most often I've tried to identify and discover that when you are taking this exam and you have in your mind that you are a registered nurse, you'll be bound to focus and answer the question as a registered nurse, but this is not the case. You have to answer this question as a practical nurse. Put yourself as a practical nurse, think as a practical nurse. And one of the ways that you have to think as a practical nurse is understanding the scope of practice as a practical nurse. Unfortunately, you have done your registered nursing course, so you don't know the scope of practice as a practical nurse. So after watching this video, go do more findings, rate on it, and you will see that as you practice more questions, you're going to discover some improvement. Now, let's get started. Now, here, we want you to understand that a licensed practical nurse, LPN, works under the direction of a registered nurse. So this personnel provides to individuals and group of nursing care requiring the application of basic knowledge, okay, basic knowledge of care, that of nursing science. That is what is needed of you. Like the other part of this video, which I will prepare, will be on fundamentals of nursing. When you are preparing for this exam, you have to focus on fundamentals of nursing. We will talk on that when I make the video on fundamentals of nursing. So you are bound to provide basic knowledge of nursing science under the direction of a registered nurse. Here, when we talk about registered nurse, is someone who has done a 4-year degree course, okay? That is in the UAE, these are the persons that go in for the registered nursing license exam. Now, the practice of a practical nurse is dependent on who? On the registered nurse, on the direction of the registered nurse. So you have to work in relation to the knowledge you have obtained, the basic knowledge that you have, and in relation to your scope and under the direction of a registered nurse. This is very, very important. Now, the practical nurse collects and documents objective data and subjective data. What are objective data? These are data that you discover in the course of your assessment from the patient, from the client. Subjective data are those that the complaints, what the patient say that they are feeling like in pain. Pain is something that only the person who feels the pain tells you how the pain is. You can't say how somebody feels pain, right? So the practical nurse does this under the guide of the registered nurse. The practical nurse contributes observations and health information to the nursing assessment and reports all data to the registered nurse. Okay? Now, the practical nurse cannot make a plan of care, cannot draw the nursing plan, but they can implement current plan that has been drawn by the registered nurse. They can implement and report to the registered nurse. Okay? They can document patient's response to nursing plan, how they are responding to treatment, to medication. They can document. We are going to see that they cannot give IV medication. They can also contribute in the revision of the nursing plan. They can contribute, but they cannot make the plan. They cannot draw the plan. They cannot plan care. They can contribute in the revision. They can implement the plan. Next, we see that the PN can administer regular oral and routine medication, antispasmodic suppositories. To who? To stable clients. Okay, the practical nurse takes care of stable clients with expected outcomes. They cannot take care of unstable clients. They cannot work on unstable clients. What do we mean by unstable clients? Clients with new signs and symptoms, acute, sudden signs and symptoms. A chronic client is a stable client per se. Okay? Now, we also see that the practical nurse can perform some sterile procedures, sterile dressings, collection of urine. This is their area of practice. This is their area of practice. They can do a tube feeding, they can suction the client. Yeah, this is their area of practice. They can reinforce teaching, but they cannot initiate teaching. Okay, the practical nurse cannot initiate teaching. This is very important. They can do catheterization, they can administer insulin, they can administer oral medication, they can administer subacute medication like insulin. They cannot administer IV medications. They can perform focus assessment, checking of breath sounds, bowel sounds, apical pulse, capillary fill, numbness. Unstable clients, they cannot do this on unstable clients. These are very important things that you have to know. Ostomy and colostomy care. Yes, clients who are on colostomy care. The PN can monitor the drainage, the characteristic, the odor, the color. They can provide skin care, can observe, break down, irrigate the colon of the established ostomy and report to the registered nurse. They can monitor registered nurse findings. Okay, we're going to see that as we practice some questions. They can also contribute to all steps of the nursing process by communicating with the registered nurse. Okay, like I mentioned before, they can implement the plan. They can contribute in the nursing care plan. They can contribute at all the steps of the nursing care plan, but they cannot draw the plan. They cannot do assessment. They cannot do that. They can carry daily activities of daily bed bag, use of urinals, bed making, transfers, oral care, position change. We are going to see this when I prepare a video for fundamentals of nursing. They are expected to know this to their fingertips. These are the areas that most of their questions come from. They can stock equipment, reinforce infection control. What do we mean by this? They have to make sure that visitors put on their masks. They have to reinforce. They take part in infection control measures. So now there are some prohibitions that the practical nurse is not allowed to carry out. I've mentioned a lot of them. There is an acronym that we use. We say they can't eat. What do we mean by that? They can evaluate, they can assess, and they can teach. Teaching, we can use another word like say education. They cannot give education. The practical nurse cannot evaluate. Only the registered nurse evaluates the patient, assesses the patient, teaches the family members. They can't start an IV. Yes, they cannot start an IV. But they can monitor a patient on IV, right? Yes. They can't hang or mix IV mix. No, you will not say the practical nurse should prepare IV medication and hang no. It is not under the scope of practice of the practical nurse. They can push IV push meds, start meds, but they can maintain and document the flow. They can maintain and document the flow. They can't administer blood or mess with central lines. We have central lines, we have peripheral lines, right? They cannot like flush central lines or change central line dressings. They cannot, unless the question comes and that is the only option, that is the least possible activity that can be done amongst all the options. But if there are other options that are least activities of all the other options, go for that. Go for that. So these are the prohibitions of a practical nurse. They can plan care, we've said this, but they can implement. They cannot create. We've said this over and over. They can't perform or develop teaching, but they can reinforce teaching. For example, discharge teaching. The registered nurse has given teaching, and then the practical nurse can reinforce to make sure that the client understands what the registered nurse has said. They can't care for unstable patients, patients with acute conditions, post-operative patients, patients with new changes of vital signs, acute, clients. They can't do that. They can't do the first of anything. What do we mean? First vital signs for post-op clients. The patient just leave the operation theater, and who takes the first vital signs? Remember, we said the practical nurse can monitor vital signs, but they cannot monitor the first vital signs. They cannot give first teaching, like new admissions. But few seconds ago, I said they can reinforce what? Education, teaching on discharged clients after the registered nurse must have given the education. They can reinforce. They cannot do first of anything. We said they can assess focus, they can do focus assessment. But when the patient comes, the registered nurse has to do the first assessment, check the breath sounds or the lung sounds and everything. The first of anything they can do. They can do admissions, discharge, transfer, first assessment after a change. They can do the first of anything. They can do. So guys, this are what you have to know. You have to know the scope of practice of a practical nurse. Let's look at some of the questions to better understand what I've been saying. Question number 1 says, the nurse works with a licensed practical nurse. Which tasks does the nurse appropriately delegate? Select all that apply. 1. Assign the LPN to reinforce all dressing. Okay, remember when we were doing test-taking strategies, we say we eliminate close-ended words like all. No, not in every case. Here we are talking about the LPN reinforcing dressing. Is correct. They can reinforce dressing. So the registered nurse can assign the LPN to reinforce all dressing. 2, have the LPN determine a client's response to pain medication. Look at the word determine. Determine has something to do with assessment, right? Evaluation. If you want to determine the response to pain medication, you have to assess. So there is some sort of assessment here. So this activity cannot be delegated to the LPN. 3, instruct the LPN to reinforce client discharge teaching. Yes, I said so. 4. Assign the LPN to take vital signs and report the findings to the nurse. Yes. So the right answer here is 1, 3, and 4. Let's see the second question. The nurse and the LPN prepare to feed a client who reports difficulty swallowing for 2 days. While chewing the food, the client suddenly grabs the throat with both hands. What's that? That is the universal sign of choking. That is the universal sign of choking. Hands clutch to the throat. How do we call that? We call that the Heimlich maneuver. Okay? That is the universal choking sign. And we have to apply the Heimlich maneuver, which is the abdominal thrust. Okay? So now, what should the LPN do? So before this class, if you see this question, what should come to your mind? You will think they are asking you to choose an activity that has put the clients on risk, right? That is what you would think. Before this class, you would normally go choose the option that you need to do in order to save this client. But that is not your responsibility. That is not under the scope of your practice. So option 1 says, assess the client's ability to cough. You don't do any assessment. Check for residual food in the mouth. Checking has some sort of assessment. Perform abdominal thrust. Gather suction apparatus. What I want you to know in this question, you go for the list. That is your responsibility. So in this case, you are with the nurse. The nurse will do 1, 2, 3 option, and you will do 4. You go gather suction apparatus. That is what you will do. What should the LPN do? The other activities are going to be done by the nurse. Let's look at the third question. The nurse provides client care with the assistance of one LPN. The nurse knows that the care is appropriate if which action is observed. What comes to your mind? Care is appropriate. So they want you to choose an activity that the LPN has done that is right and under the scope of the LPN. Under the scope of the LPN. Let's look at option 1. The LPN reposition a client diagnosed with elevated intracranial pressure undergoing ICP monitoring. This client has elevated ICP. This client is unstable. We cannot assign unstable clients to the LPN. Yes, it is repositioning, Mr. John, but it is just repositioning. Yes, it is repositioning, but this client is unstable. Excuse me. The LPN doesn't care for unstable clients. So number 1 is incorrect. Number 2, the LPN monitors the pain level of a client diagnosed with renal calculi. Monitors, look at the word monitors. Monitor has some sort of assessment, and renal calculi is an unstable client. This option, this activity should not be carried out by the LPN. Number 3, the LPN assists in the nurse with ambulating a client for the first time after cardiac surgery. Yes, this patient is unstable. The nurse is there doing the activity. The LPN only assists the nurse. It is not the LPN doing the activity. Get it and get it very well. Most of us will not choose 3. The patient is unstable. Who is there? Who is the main personnel doing the act? The nurse is there. So the LPN assists the nurse with ambulating a client for the first time after cardiac surgery. The LPN cannot do any first activity. The LPN there is assisting the nurse. So option 3 is correct. Let's see option 4. The LPN asks the nurse to feed the client diagnosed with emphysema. Emphysema. That is not under the scope of the LPN. The LPN can do feeding to unstable clients, to stable clients. Clients with emphysema is unstable. Let's get question number 4. The nurse and an experienced LPN are assigned to care for a client who had an ischemic stroke 5 days ago and is experiencing residual left-sided weakness. Which task does the nurse delegate to the LPN? Select all that apply. Yay, the nurse is with an experienced LPN. What did I say before? I said you have to be careful. This question has some words that are distractive words. There is no where number of years will influence you to practice out of your scope of practice. And I said before that when you are answering this question, be careful not to apply your experience. In this question, most nurses will immediately reflect where this practice under the personnel who is less qualified than they are and have worked in that unit for many years, and the personnel does most of the difficult tasks. Yes, I know. We will immediately think like that. No, they said LPN experience. Nowhere should your experience cause you to practice out of your scope, okay? Your years of experience has nothing to do with your scope of practice. You still continue to, even with a new registered nurse who just came or who are even on internship, they are more than you. They will still carry tasks that are under their scope of practice, and you continue to practice under your scope of practice. This said, you can now move ahead to choose the right option. Let's look. 1, reapply the pneumatic compression boot. What are pneumatic compression boots? Another name is like IPC. They call it intermittent pneumatic compression, okay? Or we call it sequential compression device, SCD. or we can still call it compression sleeve. Okay, reapply. Is it right? Yes, it's right. It's under the scope of the LPN. They can do that. 2, note if redness is present on the client's ears. Note redness. That is some sort of assessment. That is assessment. And we say the LPN cannot assess the clients. 2 is wrong. 3, change the care plan as feeding improves. No, no, no. The LPN cannot alter the care of plan. The registered nurse draws the care of plan, changes the care of plan. They can implement, they can contribute their own ideas, but they cannot change, even if they cannot. 3 is eliminated. 4, set up the client's tray and assist as needed. Yes, they can serve food, feeding to stable clients. 4 is correct. 5, assist the clients to reposition every 2 hours. Correct. This is within the scope of practice. So the right answer is 1, 4, and 5. Let's see question number 5. The charge nurse works in a long-term care facility. Which task is appropriate to be delegated to the LPN who has worked in the facility for many years more than the registered nurses? Yes, this is just the same like the previous question. Oh, yes. They said the LPN has been in this facility for many years. Yes, I know. No, 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 no. You practice within your scope. Okay? Let's look at it. Which task is appropriate to be delegated to the LPN? That is where it ends. They work in the facility for many years. It's a distraction. Damn distraction. 1, review all client medications as needed. No, you cannot review. That is not under your scope. 2, turn all bedridden clients every 2 hours to prevent complications of immobility. Yes, it's under your scope. Auscultate. No, this is part of assessment. This is part of assessment. Auscultate the lungs of the stable bedridden clients for evidence of fluid or other changes in breath sounds. Okay. Assess and document change in the activity plan for clients experiencing heart failure. Okay, I will say something. When I prepared this question is like involving the LPN and the unlicensed assistive personnel. Okay. Now in the UAE, remember, Pearson Review is a foreign board. The exam is set by a foreign body. Now in the US, we work in the hospital with so many personnel, and everybody knows what he or she is doing under their scope of practice. They have the registered nurse, they have the LPN, they have the CNAs and everything, and everybody has what he does. So in some of the questions, they will ask, some of the questions, they have responsibilities for the CNA. Now, I will want you to put in mind something. The LPN can do the activity of the CNA and her own activities. So when you see a question of this nature, you go for the least activity. You go for the least, because they will not set the question for the LPN and the CNA. In most of the question, they will set for the LPN. So some of the activities here could be assigned to the CNA and some could be assigned to the LPN. Now, if they ask you to choose many, you will choose the activities or select all that apply, you choose the activities of the CNA and those activities of the LPN. But if you have to choose just one option, and the least activity there is that of the CN, you go for that. You go for the least. You go for the least. So 4 says assess. No, the LPN cannot assess. When you hear that word, remember we say eat. They can't eat. They can evaluate, they can assess, and they can teach. So 3 has auscultation. Auscultation is part of assessment. 4 has assessment, they can assess. 1 has review. Review has some sort of assessment. So the only activity that the LPN can do here is position change. Number 6. Okay. This is the LPN delegating assignment to a CNA. You can meet a question like this. The LPN working in a long-term care facility is supervising a certified nursing assistant. Which observation indicate that the CNA needs further instruction in performing hygienic care? Further instruction is what I said the other time. It is negative event quarrel. Means you have to choose the wrong option. Something has been done that is not correct. You have to intervene. You have to re-educate. So you are looking at the options and the activity that is not correct and should be under the scope of the CNA, or the CNA is doing something that is not under his or her scope, then you have to intervene. You are not supposed to do this. Let's look at the options. The CNA washes the client's face before washing the rest of the body. Okay? Is that okay? Yes. The CNA puts 1 foot at a time into the basin of warm water when bathing the clients. Yes, 1 foot at a time. The CNA applies lotion and powder liberally after bathing the clients. Is it correct? Lotion and powder. Lotion and powder. Is that correct? Let's look at 4. The bath water contains only a small amount of soap. Yes, small amount of soap. It doesn't have to be too soapy. So the wrong option that needs further instruction is 3. You don't apply lotion and powder on the clients. Okay? Lotion and powder will cause the skin to become so moist and can result to skin breakdown. This is not a good practice. So when you see the CNA carrying out this activity, you have to intervene. Further teaching is needed. So guys, we've come to the end of this presentation. I think you should grab something from this short presentation. Go over the video again, watch it over and over, and try to practice. I will be making another video on the fundamentals of nursing. Fundamentals of nursing concerns screen sharing and stuff. Close. A moment. So I was saying that I'll be preparing a video on fundamentals of nursing. I will pick out important areas that are most concerning for the PN. Position change, birth making, vital signs. Go and read on these areas. Read on these areas. So without much ado, I've come to the end of this presentation. Please, if this video helps you, Kindly subscribe to our channel. Please share. There are many out there who need this knowledge. Share with them, and thank you so much.